Are you considering having an aesthetic procedure performed? Confused by all the information out there? Welcome to It's a Young Thing, where Nurse Paula Young arms you with the knowledge on all things cosmetic and aesthetic. And now, Nurse Paula Young.
Hey everyone, welcome to It's a Young Thing. I'm Nurse Paula Young. And you know, one of the joys of being a medical spa per se is that we do a lot of medical type of procedures that really have nothing to do with aesthetics or beauty, but make a person feel beautiful or feel more attractive or more vibrant. And one of these procedures we're going to be talking about today is vaginal rejuvenation. And I'm really thrilled to have one of our associates on a podcast today with me. And her name is Lynn Testaiuti. And Lynn is not only a registered nurse, but Lynn is also a physician assistant. And she's got a strong background in women's health issues and infertility issues. And this is something that's really dear to her heart. And she's pretty much pioneering our practice in female rejuvenation, vaginal rejuvenation. You know, a lot of women have problems with vaginal dryness, pain during intercourse, even some urinary incontinence, or maybe even after a difficult childbirth, maybe some stretching of the labia. They're not as tight in their labia anymore, and they just don't feel very attractive. They don't feel sexy. They don't feel like a woman. They feel like they've lost something when they've given birth to a child. So we're going to be talking about this today. This is a real intimate issue. So Lynn, welcome to It's a Young Thing. I'm so happy to have you.
Thank you.
And, you know, let's start out a little bit. One of the procedures that we want to talk about, this is going to be a 2-series podcast. And this is the part 1. And this is going to be on a device that we use in our office called ThermiVa Vaginal Rejuvenation. And Lynn, do you want to tell our listeners a little bit about what ThermiVa is?
Sure. ThermiVa is a procedure where a transducer is inserted into the vagina and for approximately 4 minutes in each area. And there's a tiny little chip on the end of the transducer that heats up the vaginal tissue to create increased blood flow and some new tissue growth. The procedure is not painful. It's very comfortable. And it's primarily done for urinary incontinence, stress urinary incontinence, the type of incontinence when you cough or sneeze. It's also done to increase vaginal lubrication for women who experience problems either before menopause or after menopause. It also can increase the ability for a woman to be a little more aroused during intercourse, and also to help with vaginal dryness, and also with can help improve the elasticity of the vagina.
Yeah, you know, there's really 2 distinct groups, isn't there, Lynn, that we treat with ThermiVa. And one of them is the sexual group, and the other group we refer to as the functional group. So the sexual group would be the women who are having difficulty, like you said, with orgasm, tightening up of the labia and the vagina. Mm-hmm. But also the functional part of vaginal rejuvenation is, you know, better lubrication, and it helps with mild to moderate urinary incontinence. So it's a lot more than just looking better down there, looking more beautiful down there, but it's actually feeling better. And, you know, a lot of women have problems with urinary incontinence, and this is really a nice, non-invasive, non-pain way to help with that problem. So let's talk a little bit about the treatments. Like, how many would you recommend a patient get?
Sure. So the recommendation is for 3 treatments of ThermiVa to improve the symptoms that we were just discussing. And also the one thing I didn't mention was sort of what you had alluded to is the outside appearance of the labia. There is a significant change in that if that's something that you're looking forward to accomplishing, if that's one of your goals. But definitely 3 treatments are recommended.
And how far do you spread those apart usually?
Usually 4 to 6 weeks.
About 4 to 6 weeks. Okay. And is there any downtime for a patient, do you think?
No, there's no downtime.
All right. So one of the things, ladies, that you really have to understand with this is not a once and done kind of treatment. Any non-invasive treatment usually doesn't give you instant results with one treatment. Anybody that tells you that, I mean, I'd really like to see that therapy. This is a series of treatments that you have to gradually get the tightening and the lubrication and the healing of the tissue over time. And really, after about 3 treatments, we usually say that the success rate is about what? About 75%?
Yeah, I'd say a little higher than that.
A little higher than that. Mm-hmm. And not everybody's going to respond to this, right? So
correct.
What are some types of conditions that maybe a woman wouldn't respond to this type of therapy?
So if the urinary incontinence is not, mild to moderate, then the couple patients that I've seen who have not improved with the urinary stress incontinence have been that group. 2 patients in particular were, in their mid to late 60s, where the urinary incontinence had probably been there for an extended amount of time, and they did not see a benefit from that.
Yeah, and this does, ladies, also, it overlaps with a lot of things in the medical arena. You have to have up-to-date pap smears. What else would you have to make sure that you have?
Right. So, if a patient comes in, we need to make sure they've had a recent exam to make sure that there's no abnormalities or any types of, cervical issues, whether it could be an abnormal pap smear or a fibroid uterus. So we do need to have normal routine GYN care established.
Yeah, and I think also their hormones need to be in balance too, because, women's hormone, we go wacky. I mean, I'm 55 this year. I don't know about you, but hormones start going wacky, and it can affect a lot of different things. I mean, not only everybody always associates it with hot flashes and mood swings and things like that, but it also does interfere with vaginal lubrication and dryness and urinary incontinence. I mean, it can really lead to a lot of things. So, also having a good hormonal workup is probably going to be very beneficial.
Yeah, and I've found that a lot of patients aren't interested in taking hormone replacement therapy. So they're looking to ThermiVa and to the O shot to accomplish their goals without having to take estrogen.
They're looking for the holy grail. Yeah. And that's great that you mentioned the O shot, because I had mentioned to our listeners here that this is going to be a 2-part series. So part 1 is ThermiVa Vaginal Rejuvenation, which is the non-invasive vaginal rejuvenation procedure that we do. But the part 2 of this podcast series is going to be the O shot. So you really do want to make sure, ladies, if you're having difficulty in this area, that you listen to our upcoming podcast in the future on the O shot. So, we already talked about that getting back to the procedure, there's really no recovery time on this. You can kind of come in on your lunch hour, get this done, and leave the office. And there's really not too many contraindications other than severe urinary incontinence, maybe some recent cancers.
There's a prolapse. Yeah, there's a prolapse. That would be a problem.
That would be a problem. Right. So usually you're going to recommend to your patients that they should have a gynecological exam.
Yes.
Prior to?
Yeah, we ask that they bring in their last pap smear and GYN exam.
That's fabulous. All right. Is there anything else that you want to add about the ThermiVa? I mean, for your patients?
Sometimes what we'll do is if we'll do a series of ThermiVa and their goals have not been accomplished, then we will ask them to consider the O shot.
Mainly just for orgasmic reasons?
And for stress incontinence.
Stress incontinence as well. Okay.
Right.
Well, you heard it here, ladies. There's a lot that you can do to make yourself feel more beautiful. Not always look more beautiful, but just feel more beautiful and feel better about yourself. And these are one of the things that we really love doing at Young Medical Spa, is being able to make you feel as beautiful inside as you feel beautiful on the outside. So we're really thrilled to be able to share these series of lectures with you, or these podcasts with you. So make sure you tune in to next week's episode on the O shot for part 2 of this series. That's all I have for you today on ThermiVa and Vaginal Rejuvenation. Lynn, thanks so much for joining us this week.
Thank you.
That's all I have for you this week. Make sure you subscribe to our podcast on iTunes, SoundCloud. They're available on our website. And guess what? We're now live on iHeartRadio.com. So that's right. You can also listen to all of our podcasts on iHeartRadio.com. We're really happy to be part of the iHeartRadio family. Thanks so much. We'll talk to you all next week.
You've been listening to It's a Young Thing with Nurse Paula Young. If we didn't discuss a topic you're interested in today, be sure to subscribe to our podcast on iTunes, so when we do, you don't miss it. The cosmetic aesthetic world can be confusing. We're here to arm you with quality, truthful information from our many years of experience. For even more info, youngmedicalspa.com.
This has been a Steve Mittinen social media creation. Steve Mittinen, socialmedia.com.
creators, producers, participants, and distributors of this podcast disclaim any liability in connection with the material expressed herein. This information should not be substituted for individual medical counseling. Information on this podcast is not intended to diagnose or prescribe treatment for any condition. It is intended for educational purposes only, based on the research and experience of Young Medical Spa. Discussion of specific treatments is done only in an office visit directly with the patient. Contact our office to schedule.